Okay, so thank you everyone for coming back after afternoon tea. I know it was a really short break, but we've got some great presentations this afternoon. And just to try and keep us on time, I will give just a very short introduction to someone who probably doesn't need much of an introduction after this morning. Dr. Brian Skotko is a board-certified medical geneticist, and he's the co-director of the Down syndrome program at Mass General Hospital in Boston. And we're really honored to have him speak with us today. Brian's going to be talking about keeping children and adolescents with Down syndrome healthy. So thank you very much, Brian, and appreciate everyone's attention and listening to Brian's talk. Thank you.
Yes, testing, and this side, testing, great. Thank you, Ellen, and thank you so much for coming back after break. There's so much I would like to cover with you. As Ellen mentioned, my main responsibilities is to be a doctor, and my colleagues and I at Massachusetts General Hospital and Harvard Medical School see about 500 to 600 patients with Down syndrome of all ages every year, and we've learned so much with and for our patients, and I just want to give you some updates on medical care. I want to also start with the proviso that medicine is as much of an art as it is a science, and therefore there is not necessarily one right way to practice medicine. So I'm going to share how I practice medicine with my colleagues at my hospital, but it doesn't necessarily mean it's the only way to do so. Over the next 30 minutes, I want to say, how do you make sure that your son or daughter, your loved one with Down syndrome, is getting the best medical care possible? What are some other medical conditions that go along with Down syndrome that are treatable and even preventable? And what are some healthcare resources that you could access right now on the internet to make sure that your person with Down syndrome is getting good medical care? So those are our goals over the next 25 minutes. My slides are arranged such that the facts are at the top with some details at the bottom, and I have shared all of these slides with the organizers for this conference and gave them permission to hand out those handouts. So if you would like copies of this handouts, just ask the people at the front desk and they'll be able to get you a copy. But we start right in. As you know, up to 3 out of every 4 people with Down syndrome will have some hearing loss at one point in their lives, and hearing is so important for speech and it's so important for learning. As such, in the United States, we recommend that everyone get a hearing test at birth, at 6 months, at 1 year, and then every year for the rest of their lives. And that's because there could be conductive hearing loss. Something is in the way and we have to remove it, like earwax or fluid behind the ear tubes. It could be sensorineural neural hearing loss, where the nerve conduction is not working properly. In that case, we want to make sure we have amplification systems and we want to have hearing aids in process. Or it could be a combination of both of those. And in working with your doctor, if you need a specialist, oftentimes it'll be the audiologist or the ears, nose, and throat doctor who will be there to help you out. We know that the world can become blurry and there could be vision issues for people with Down syndrome at any point throughout their lives. If you can't see, it's going to be difficulty learning in school. So as a result, we really do recommend getting those vision tests annually up until the age of 5. And then if there's no visual issues whatsoever, you could space it to every 2 years and then to every 3 years. But people with Down syndrome have all sorts of visual issues, but you see that they can be corrected with eyeglasses, by working closely with an eye doctor. Sometimes the muscles of one eye is weaker, and so we need to strengthen those muscles. That could be done with patching or eye drops or sometimes surgery. Sometimes there are cataracts that will get in the way and they need to be surgically removed. And sometimes the tear ducts can be obstructed and we need to help them out. We've heard a lot about thyroids today. We know that thyroid could be too high or too low in people with Down syndrome, but look at all of the symptoms that could go along with thyroid being off. And since thyroid could change at any point throughout their entire lives, we need to make sure we get that blood work at 6 months, 12 months, and every year for the rest of your life. We've learned that the way thyroid works is our brain gives us a signal called TSH, and that comes down to our thyroid represented in the green pentagon in my illustration here. Your thyroid gland then produces something called free T4, which then circulates throughout your body. Every year you should know your child's TSH and free T4 value, because sometimes you can get a pattern where they don't have enough, they have too much, or they're somewhere in the middle. And in each one of these circumstances, we want to make sure that we correct that so it doesn't interfere with cognitive development or any of the other symptoms. If your son or daughter has too little thyroid, we could give it back with levothyroxine. If they have too much thyroid that they're naturally producing, there's medicines to sponge it up. And in the third category at MGH, if we start to see this pattern, we start to initiate treatment with low dose of levothyroxine. Just a brief pause. We've talked about today lots of different medical playbooks. In the United States, we too have a medical playbook for people with Down syndrome, and it was updated in 2011. This tells us what we want to achieve for every person with Down syndrome. If you would like to get your copy to bring to your doctor, you could just go to healthychildren.org, and you will see these are available for free. This is the one for children ages 1 to 5. You could download this, take it into the doctor, and just make sure they go through the checklist if you would like to follow the American guidelines. There's one for ages 5 to 13, one for 13 to 21, one and older. So it's really taking those guidelines, everything I'm talking about today, and being able to share those with your doctor, again, available for free. Going back to some other medical issues, celiac goes along with Down syndrome. This is when your body starts to, the immune system, attack your stomach and your intestines when certain foods are introduced. And those are foods that contain gluten, such as barley, rye, and wheat. And so as such, you have lots of gastrointestinal issues, and those could be diarrhea, constipation, bloating, vomiting, abdominal pain, but usually someone with Down syndrome starts to manifest that with behavioral issues. So if your stomach is not feeling well, and you can't necessarily describe that to your family members, you could have behavioral issues. So it's really important that any disruptive behaviors or difficult to control behaviors, you also look for a medical explanation, and sometimes that answer could be celiac. We do that with a blood screening test. If that test comes back positive, we'll then do an intestinal biopsy where a small little sample is taken, look at under the microscope, and a confirmative diagnosis of celiac can be made or not. The treatment, which is 100% effective, is simply to avoid those foods that contain gluten. And I know that life could be just as delicious on a gluten-free diet because my wife has celiac disease, and we have been enjoying delicious foods here for over a week in India that are completely and entirely gluten-free. I want to take a quick pause. Everything I'm talking about, you're like, but wait, I have more questions about that or that. To honor one of the late mentors of mine, Dr. Alan Crocker, at the previous hospital that I worked, we created a whole webinar series. So if you go to childrenshospital.org/Down syndrome, and you click on Speaker Series Information, we have about 30 different webinars on every medical issue you could hope to learn about for someone with Down syndrome. And this is what it looks like. They're all entirely free. They're about 30 minutes in length. You can enjoy them from your own home. This is the one on celiac and Down syndrome. So you could see here are the slides, and then you have a doctor in the upper left-hand corner explaining things in a way that's easy to understand as parents or grandparents. So any slide that I present to you today also has a full corresponding webinar that you can access over and over again at home. People with Down syndrome are constipated until proven otherwise, is my belief, because constipation is so prevalent. This is a patient of mine who came to see me where the parents said, the school says she's so disruptive, we can't control her behaviors, I don't know what's going on with my daughter, she's just behaviorally a terror, right? And we're trying all these behavioral techniques. So I asked, how often is your son or daughter going to the bathroom? Well, I don't know. I don't look at her every day, and I don't know if she's going to the bathroom in the school. Unless I know for sure that your son or daughter is having a regular bowel movement every day, I'm very quick to get an x-ray. And the way we read x-rays is anything that black is air. So here's our lungs, and we should have air up there. And here's the side of the person. Your colon, your large intestines, if it had no stool in there, should be black, full of air. But instead, it is white. So here we have stool, 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 speculated stool. This is an entire abdomen full of stool, right? So we gave her some medicine to clean her out, and we gave her a makeover, and isn't she gorgeous afterwards? So now we've replaced all of these stool balls here are completely cleaned out. We have nice air pockets here, completely cleaned out. We sent her to school the next day, and 2 days later, the teacher wrote a note to the mother and said, what psych medications did you finally put her on? She's so well behaved. And we wrote back and we said we put her on a stool softener, right? Stool hurts, and you want to make sure that people with Down syndrome know it's important to have a regular bowel movement. And if there's not, there's lots of different medications that could help. We could either bulk it up, we could help soften it down, we could help slide it out, we could squeeze it out, or we could water it down. And yes, after all these years of education, I've become an expert in stool removal. But it's important for people with Down syndrome, and definitely consult your doctor so you can figure out what combination of these medicines might be important for the person with Down syndrome you know. I'm so lucky that prior to being seen in my clinic, we ask for an intake form to be completed, a questionnaire, and sometimes I get invitations to birthday parties, I get invitations to weddings, sometimes I actually get pictures ahead of time. And this is a picture I received from a mother who said, "I can't wait for my son to see you. He's driving us crazy. His behavior is off the wall. I don't know what to do." And this picture is worth 1,000 words because we could see the diagnosis already. Do you see it? This is a patient who has a very, very severe diagnosis. And if we zoom in and we zoom in, this is someone who has whopping tonsils, and there is no air and oxygen, or at least not a sufficient amount of oxygen, getting back there while he's sleeping. This is someone who has severe obstructive sleep apnea. We've already heard great lectures today, but obstructive sleep apnea, just to underscore again, is very prevalent in people with Down syndrome. Up to 75% of people with Down syndrome will develop apnea at one point in their lives, and like my sister, it will come back and back and back again. We know that if apnea is there and it is not treated or it's ignored, you could lose up to 9 IQ points within a year. And we work so hard for those IQ points, we definitely don't want to lose them to apnea. So we need to get a sleep study test, and that's where you sleep overnight in a hospital and we measure oxygen levels. Certainly, if your son or daughter says yes to any of these questions here, you want to make sure they get a sleep study. But the most challenging thing is a lot of obstructive sleep apnea in people with Down syndrome is absolutely silent. It gives us not a single clue whatsoever. And because of the prevalence and because it's so silent, in America, the recommendation is everyone gets a sleep study by age 4. And if they're older than age 4, they need to quickly catch up and get apnea because we're picking it up so prevalently. If they've had their tonsils and adenoids removed, you're not off the hook. Like my sister, the adenoids could regrow. Even if they don't grow, apnea could still return. If it does return, we're going to go back for another sleep study test. I want to say that sleep study tests are not the most enjoyable experiences for anyone, but we've created some handouts in order to help prepare for those sleep studies, which you're welcome to use. And here's a fact sheet to share with your doctor if your doctor is not necessarily aware of the importance of the mission of testing for sleep apnea. We know that so many of our patients with Down syndrome can be frightened or anxious when they're going for procedures that they don't know what's going to happen next. So we've created a storybook, and this is a storybook where each page corresponds with a picture and words of what's going to happen in our sleep study center. So we encourage everyone with Down syndrome to read this with their parents every day about 5 days prior to the sleep study test. Then they bring this book in, and our technicians do it page by page so that there's nothing unknown or fearful. And again, there's nothing invasive about it, but it could be frightening if you don't know what's going to happen next. If there's nothing surgically to remove, sometimes a mask is necessary. Although it might seem like a daunting proposition, I do have many patients with Down syndrome, including my sister, who is able to successfully wear a mask. If the mask is not possible, there are some other surgeries that we're now able to do. Down syndrome also comes along with many other medical conditions and mental health conditions. We like to say over and over again, it's not just Down syndrome until proven otherwise. People with Down syndrome have an increased chance of developing ADHD, and just like a neurotypically developing person with ADHD, they can and do benefit from medicines to keep them in the game and focused at school. Obsessive compulsive disorder also goes along with Down syndrome. Sometimes people with Down syndrome are the neatest ones at home and the most lined up at home, but when that gets in the way and that disrupts their lives, we need to restore their brain chemicals back to what they originally were, and there are important and safe and good medicines that will help us do that. Depression and anxiety go along with Down syndrome at increased rates, particularly at the adolescence or older years. Big changes in lifestyle could often trigger this. When grandma dies, we are all sad. But usually about 6 to 8 months later, we're able to honor grandma's legacy and move on. Some people with Down syndrome mourn grandma's death, and they continued to mourn for years at a time. I once had a patient with Down syndrome who was 16 years old and was always excited, always talking, always ebullient, and her mom said for the past 3 years, she'd been like this. Hey, Katie, what'd you do today? Who are some of your friends? What do you like to do for fun? And I asked Mom, okay, when's the last time she's been talking? She said, about 3 years ago. And so we're going through the medical workup. It's not thyroid, it's not sleep apnea, it's not constipation. And then when I say, well, what does she talk about when she does talk? And so occasionally she mentions my mother's name, right? And I said, well, what happened to your mother? She said, well, my mother, her grandmother, died 3 years ago. As though it was yesterday, she's still mourning grandma's death, right? And a low-dose, simple medication for depression in a month brought her back to who she was, talking and restored again. People with Down syndrome sometimes need our help with medication and supports. This is a great book I highly recommend if you have adults or adolescents. This chapter by chapter goes through all the mental health illnesses that go along with Down syndrome, but more importantly, comes up with hopeful options for making sure that people with Down syndrome can be restored back to who they are. We know that people with Down syndrome can also have autism spectrum disorder. Some studies suggest up to 1 out of every 10 or 1 out of every 5 people with Down syndrome could also have the diagnosis of autism. What does this look like? It's someone with Down syndrome who sometimes is nonverbal or have increased expressive language issues. Someone who has repetitive behaviors. Sometimes there's twirling, sometimes there's flapping, sometimes there's stimming to calm down, and it's all 3 and more, difficult with social situations. So unlike the typically developing person with Down syndrome who's social and greeting and playing and looking you in the eye, these will be people with Down syndrome who prefer to be on their own. Right? People with Down syndrome who prefer to play on their own than play with others. If they have all those combinations, the reason why I feel it's important for them to be seen by a psychologist or a neuropsychologist is if they also have autism, there is behavioral therapy that can and does, and by evidence-based has shown to work. And that's applied behavioral analysis or a discrete trial training. And we know at least 25 hours or more per week really does benefit those with Down syndrome and autism. You know you are not alone when there's a whole book written about you. This is a book when Down syndrome and autism intersects, and it's a guide for parents who have children with both diagnoses. They have said over and over again, we don't feel like we belong to the Down syndrome community, and we don't feel like we belong to the autism community. Well, I'm here to say you do belong, and there is a whole many families out there who are in your shoes, and there's an online community and also a book that I would encourage you to check out. These are all available through woodbinehouse.com, but you could also get them through Amazon. Seizures can go along with Down syndrome, but Down syndrome-specific seizures tend to occur before the age of 1 or after the age of 30. And I want to show you something called infantile spasms. This is a Down syndrome-specific seizure that could occur up until about 15 months of age. This is one of my patients, Benji, and his mother captured this on her cell phone. She sent it to me and said, Dr. Stockel, I'm concerned about some of his movements. This is all normal baby movements, but that flick right there of his hand, that is a seizure. And if that seizure is not taken care of immediately, that can lead to lifelong consequences in terms of neurological development. This is a very astute mom. This is normal baby movement, normal baby movement, normal baby movement. Right there is a seizure. Very subtle, but we want to catch it as soon as possible. This is called an infantile spasms. When the seizures start to develop and they're a little bit more advanced and they're
Benji, it's
untreated,
okay, honey.
this is a video
It's
that
all
turned sideways
right.
for some reason, but you'll see what it looks like when these seizures are in a later stage. Boom. You have jackknifing or
honey.
movement of all 4 extremities.
It's okay.
If this is seen in someone with Down syndrome, it is a medical emergency. Those seizures do need to be stopped. If they're not stopped, it could lead to
I'm
long
sorry,
consequences.
sweetheart.
Again, these are the type of
Hold on,
seizures that
Timmy.
we're all looking for up until about 15 months of age. And if you do see any of these movements, it's important to go to your doctor and more
Oh,
importantly,
Ben.
to the emergency room to get them stopped. And sometimes they could cluster right
He woke up from
after,
his nap, like,
napping,
20
which is what
minutes
happens
ago,
here, and there
and all
you
of a
go.
sudden he's
You
doing
see the
this.
seizure again. I'm so lucky every day to be able to have my dream job where I get to take care of people with Down syndrome, but it's not possible without an incredible cast and crew, and this is who I get to work with. My longest serving employee that I hired is Mr. Ben Majeski right there. He has Down syndrome. He's a full employee in our clinic. He's the first person to greet you when you arrive, and he also takes you to the room and spends about 5 to 10 minutes with every patient that comes to see us. If your son or daughter has celiac disease, no problem. Ben's on a gluten-free diet. If your son or daughter has sleep apnea, that's not an issue because he wears CPAP at night and will coach you into it. If you want to know what it's like to get a girlfriend and date, he has a whole speech about getting a girlfriend. And if you want to know what you do when you're sick and tired of your parents and how do you move out of the house, he describes how he moved out of the house and is living semi-independently with supports. I'm excited to share for the first time something that our clinic has put together, and we're working on building a virtual clinic for people with Down syndrome. I'm very proud of the clinic that we have, but it's not financially sustainable. It's very expensive to do this, and even in the United States, we estimate with all of the 50 Down syndrome clinics we have in the United States, only about 5% of people with Down syndrome are going annually to one of the Down syndrome specialty clinics. So even in the United States, we're not serving close to 95% of our patients with Down syndrome in our specialty clinics. So we received a grant from our government, and we are in the process of building a virtual clinic where you'll be able to go online, enter the symptoms, enter the concerns of your son or daughter with Down syndrome, and then in your email inbox, you will get a personalized checklist of access to all the information we would normally give if you'd come in person. And I want to show it for the first time in a public setting. So this is what it will look like. It's a 10-chapter scenario. You go here and you say the name of the person with Down syndrome, their date of birth, and whether they're a male or female, and it has branching logic. So we're going to then subsequently ask different questions if you have a 2-year-old versus an 18-year-old versus a 60-year-old. We're going to ask different questions if you have a female versus a male with Down syndrome. So we try to keep it as limited as possible, but as robust as possible. There's different chapters here about medical concerns. So if you go to chapter number 2, it'll say, in the past, month or so, are any of these an issue or a concern to you? These are the type of things you would be telling if you came to me in clinic. So yes, I'm concerned about weight gain. I'm concerned about vision. Oh yeah, there's a fever that hasn't gone away. And there's lots of different things that you're able to check off. We also ask questions about behaviors and mental health issues. We're going to ask questions about immunizations, about nutrition, about school, etc. There's also questions about blood work. So has your son or daughter gotten a hearing test recently? Have they had a sleep study test? This is all going into the program that we've created so we can develop the right recommendations based on the symptoms you have. We then asked about school and therapies and education and development. We ask about life skills. If you have a 13-year-old and older, are they developing the necessary life skills to live a semi-independent life? And oftentimes we'll ask questions about resources within the community. This is such that the more you fill out, the more you'll get in response, but lots of the sections are optional. So if you only want to complete a couple of them, that's entirely up to you. What my team and I have been doing over the past year is coding every single one of these questions. So if you come to me in person to see me in my clinic, you say, my son or daughter is 6 years old, and they're having behavioral issues, Dr. Scotco, and they're taking 2 naps during the day. I've learned if you said this, this, and this, that means my brain says you need to get a sleep study, right? Or if you say my son or daughter is tired, they're droopy, and they haven't had any blood work done in the past 2 years, my brain says you need to get some thyroid, right? So why can't we code our brains to telling the computer what to do, right? So I've gotten all of my colleagues together, and we've been writing every scenario that we come up with in clinic so that if you click this, 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 and this, you'll get a personalized outcome. And this is what it looks like. When you get to end of chapter 10 and you press submit, the magic button, you will get a personalized checklist, and in this case, for Kristen, right? So this says, here are the urgent things for Kristen. You need to go to your doctor right now and get this blood test because based on what you said Kristen has a new limp and she has a fever that hasn't gone away in 5 days. And because she's less than 6 years old, this could be a sign and a symptom for leukemia. So this is a very urgent condition. But then we have non-urgent things like down here. We recommend that you go to Kristen's doctor the next visit and ask for celiac testing because Kristen has symptoms that might be consistent with celiac disease. And then you say, well, why are you recommending that? If you click on the why button right there, it will then say, well, you clicked, Kristen has bulky or foul-smelling stool, she has constipation, and she has not had blood work done in the past 12 months, and we know that these are symptoms consistent with celiac. So we'll also give you the codes behind the scenes so you could discuss that with your doctor, and hopefully we'll be able to codify it together. But most importantly, we have searched around the world at the best resources that are available in order to provide links there. So if you have a question about, for example, toilet training, you say, my son or daughter with Down syndrome is not toilet trained. If you come to see me in clinic, I don't have time in our 30-minute visit to teach you how to toilet train, but I have a 60-minute webinar that will take it step by step on how to specifically train someone with Down syndrome to be toilet trained. So why can't you have it? Just click right there. I'll take you right to the free webinar, and you have your answer, right? And so we're also seeing that maybe Kristen has a certain type of arthritis that goes along with Down syndrome. But click here, and it'll take you right online to information so you can learn more. So really try to personalize and really call the best information that's out there, again, around the globe, so it's available here. And then we also have some stories and some social stories. So this will be the checklist for the moms and dads. When you press submit, you'll also get the companion document that you could take to your doctor. So this will be the personalized checklist for her provider, and we've been working with primary care physicians to write it in doctor language, right? So it's the same recommendations, but we say, okay, based on how Kristen's mom responded, you gotta get thyroid, you gotta get a sleep study, you gotta get hemoglobin level, and she's due for her hearing test. So it's a way of making sure that we take the recommendations, the best information, and funnel it through. We also then give new potential diagnoses. Kristen might also have obsessive compulsive disorder, and as a doctor, we think you should talk about it because Kristen's mom said she has ritualistic compulsive behaviors and gets obsessed with ideas, and that's all based on what she picked online. Then we also will have a website for doctors with a library of all the links to all the best healthcare resources on the internet that we could find right now for people with Down syndrome, so they could have that as well. It's not possible without a whole research team, and this is the research team I've been working with daily to make this happen, including Ben, who has Down syndrome, who's been involved in the creation, and our engineers. It's going to be made available to people living in the United States in October for the next 2 years, and after 2 years of testing it in the United States, we then hope to make it available to everyone in the world, so 2 years from today's date. If you want to stay tuned or you're interested on any of the research or the clinical work that we're doing at MGH, here are our 2 websites. We have a clinical website, and we also have a research website. You could follow along there. If you're ever interested in coming for a clinical appointment, you just need to click on Request an Appointment, and it has all the details if you ever were in the Boston area. I'd be happy to see you. We also are on Facebook, so once a week we try to post healthcare updates about the latest research about healthcare for people with Down syndrome. You can find information there, and we also post updates on Twitter as well. Here is my contact information, including my own personal website, where I have posted information about the research I've done and the books that I've written. Since several of you have asked, you could get it there as well. And there is my email address, which some of you have asked. Let me just conclude by saying that, again, medicine is an art as much as it is a science. There's multiple ways to practice art, and I know that we are a global community, so let's do this together to make tomorrow better than it is today for people with Down syndrome. Thank you very much.
Thank you so much, Brian. That was really excellent. And I know all of us are just eager for those 2 years to go by quickly, because I'm sure we'd all like access to that fabulous resource as soon as possible. So it's very exciting. We have time for just maybe 2 questions from the audience. We are running behind time because of our tea break.
You have many excellent doctors here in India. You don't need me, so I would work with them on the necessary funds that they need to expand their good clinical services here. I see a hand. Yep.
My daughter is 1.5-year-old, so I just wanted to ask, in the night when she just goes into sleep, once in a while she moves her 4 limbs, like as you explained about the seizures. So could that be a probable reason that but it happens very rarely. You can say once in a week or something like that.
Yeah, it's a great question. So we know that during sleep, we kind of cycle in and out of phases. And as we go through certain phases, our body is more apt to move. All of us can move. So certainly it could just be her cycling through those phases or reacting to a dream. We also know that people with Down syndrome could also have what's known as periodic limb movement disorder, which is just a fancy way of saying that they could kick a lot at night. And we do know that sometimes that could be due to a low iron level. And so whenever anyone kicks a lot at night, I like to check an iron level. And if it's low, some of our patients actually have been shown to be responsive to iron.
Thank you.
So can we get the iron levels, when we talk about iron levels, is the CBC the only thing that needs to be done, or any specific test that needs to be done?
Yeah, for the periodic limb movement disorder, you need to get a ferritin level in addition to the CBC. So we're really looking at the ferritin. And if it's less than 50, there's some research that shows that sometimes iron supplementation could be helpful in decreasing the kicking.
Thank
But
you.
just remember, iron causes constipation, so then you need to look out for
we have
constipation.
not been giving her any iron supplements. That's why I wanted to ask this. Okay, thank you.
Thank you, and thank you very much, Fern. And we have a small gift for you as well. Thank you. So we're going to move on to the next talk, which is by Dr. Shanti Aluk, which is about inclusive education. And Dr. Shanti is a parent and has a PhD in psychology, and is joining us on the stage. So please welcome.
I'll just make a little correction. The topic of my presentation is not inclusive education, but nurturing growth, a lifespan perspective.
My apologies.
There was something I talked to the organizers, and there was something, so I'm just making that correction. I'll just show you. Sound is not there. Sorry? No, it's not coming. Doesn't matter. Anyway, meanwhile when it gets set up, I see a lot of younger parents, comparatively much younger parents, and thank you. And what I'm going to talk to you is about the whole lifespan. And you see, I'm perhaps the oldest mother here, and my son, who has Down syndrome, he's 41. So I have seen a whole range of developments, and I would say not only challenges, but very insightful journey with my son, and that is what I'm going to share with you. And not only my son, but through Muskan, I'm in touch with hundreds of people with Down syndrome and other forms of intellectual disability. So whatever I'm going to share with you is all based on observations and insights that these young people have given to me. I think it's all right. Let us continue. आप वो दूसरा खोल दीजिए. So why did I choose this topic? Because, you see, what I felt was that somehow I never found anywhere in the literature also when I refer to various books or journals or other kind of literature that, like everybody else, people with Down syndrome also go through the same life stages as any one of us do. Infancy, not only chronologically, not only age-wise, but the changes which come with new dimensions which get added to the mind, and each of these stages bring a new unfoldment in the way mind functions and therefore, thereby the way individual experiences his or her world. So, what I realized was that everything is going exactly the same. Infancy, childhood, adolescence, young adulthood, matured adulthood, then old age. And whatever kind, many of you are much younger and you know, you see what kind of changes occur, but like I'm a 70-year-old, so myself also traversed all those unfoldment which happen, and that has given me a kind of understanding about these young people, because some of our, you see, students, trainees, or workers are as old as 60 in Muskan. So, the needs are just the same like anybody else. What we call psycho, social, and emotional needs. And they may not be able to articulate all that to others, but there are various forms. You have to be very perceptive also to discern that why this kind of a behavior is coming. And you can always find, because behavior is always very orderly. It is lawful. So it's never random. And with none of us, it is ever a random behavior. So it is with them also. So, the growth follows universal principles, and they can grow to be responsible, caring, and cherished members of the family, of the society, if we respect them, whatever their stage in life is, as adults and as adolescents, and respect their worldview. That is very important to understand, because worldviews also changes with the growth that happens, inner growth, psychological growth, mental growth, which happens. And if we also create or enable them to adopt responsible roles in the society, otherwise you remain unhinged. It is very important to create such roles for people with Down syndrome as well as all other forms of intellectual disability. What is the meaning of personal growth, inner growth? If we look at it, we grow thinking-wise, which is cognition, the way we understand the world, the way we view our world. One example I would say, you see, as we all step up in adolescence, we know a whole new world opens to us. And so much interpersonal relationships become so much more important. The emergence of sexuality in our life. So these are the kind of growth changes which are occurring. Emotions. There is the emotion is so very important. In fact, most of the time, when we are not really understanding what kind of emotional needs we are having and how we are expressing, whether it is helping us or it is not helping us. That is what we call by emotional maturity or emotional growth. And then behavior, because the way I perceive the world, the way I feel about the world is going to affect my behavior also. How do I respond to various kind of situations? So what I have found is that all these three areas, if we are, and you don't have to be a psychologist, every parent has gone through these kind of stages, we have to be a little more perceptive and insightful. Now, when we work, we nurture the growth of cognition, emotion, and behavior, what happens is that there is a sense of self-direction and self-regulation. That means you don't have to tell every time, do this, don't do this, and unfortunately, very often it happens with our children that we keep treating them as children and keep telling them, don't do this, and so on. It doesn't bring results because something else has to happen, and then self-regulation. They themselves would be able to discipline if we work on the growth in all these areas. Emotional and social well-being, it brings sense of self-worth. I mean, each of these topics is actually a huge topic, so I can't really do justice, but we all know how important it is to have a positive self-image. All these things enable them to become better learner. How do we enhance their horizons of thinking? Very often we say they are very rigid, they are very inflexible, adaptive skills are very little. Adaptation requires flexibility of mind. Flexibility of mind comes when I can understand the world as much as we can. With people with Down syndrome, it does not happen automatically. We need to support them. And how do we support? By exposure, by talking, by explaining, by so many. I mean, I tell you, my son with 41, he's 41, and he is working in one of the hotel in Delhi. And when he was, 5-6 years of age, the psychologist measured his IQ to be 50. And what he behaves is very different than that. And that has given me so much of confidence for all the children. No, it does not. This IQ business is very, very limited way. How we deal, how we respond, how we interact with them makes a whole lot of difference. And all our dialogue, everything happens through dialogue. If I have to tell him something, I have to explain why I am saying so. Every conversation has a mature adult-like behavior. That does not mean we don't have fun. We have a lot of fun together. So flexibility of mind comes when we have better understanding about the world, and that can be created through a good, friendly dialogue. Then, and all these things are going to enhance the adaptations to various situations and also the quality of life. What makes up our world? If you analyze a little more deeply, you'll find how we think, how we feel, what are our needs, and here I am referring to psychological needs, a lot of psychological needs, how relating with others, affection, approval, sense of achievement and competence, these are the psychological needs. Temperamental inclinations, everybody has a different, some are very outward-oriented people, some are very inward-oriented people, and these some are more more anxiety-prone, and others are more happy-go-lucky type. So these temperamental inclinations are like a general population, and habits and behavior. Now, here habits is very